Welcome. I'm Gary Phillips, Mayor of San Rafael, and I'm joined today with Dr. Matt Willis, who is the Marin County Public Health Officer. This is a continuation of our message from the Mayor centering on the coronavirus or the COVID-19. Previously, we covered areas like hospital preparation with Pat Kendall, actions taken by the county with Damon Connolly, systems of various federal lending programs featuring Russ Colombo is the president of Bank of Marin. And we also covered what we're doing with regard to supporting our small businesses. Today, I'm pleased to be joined by my friend, Dr. Matt Willis, and he will cover various aspects of the coronavirus, including the latest county order and perhaps his own personal experience with a bout of the virus. I'm glad he's still with us. Matt lives with his wife and 3 children in San Anselmo. He's a physician, received his medical degree from Temple University, master's degree in public health, internal medicine from Harvard, and he will cover for us, among other things perhaps, but certainly to include, what does the future look like? When will the order be lifted so normality can resume? Testing opportunities, readiness of Marin hospitals, and words for the high-risk population, those over 65 and with other conditions. So, Matt, welcome again. Thanks for joining us, and it's all yours.
Thank you. It's great to be here with you today. And it's great that you had Pat Kendall and others kind of offering their perspective on this. Key partners with us. Supervisor Connolly has been, close to this process all the way along. I'm here to offer the public health perspective. This is a public health crisis. The COVID-19 epidemic as a pandemic has really brought public health into a position of a lot of responsibility, and I'm really fortunate that kind of the stage had been set in Marin for collaboration, and our team has been really well supported, and every step we've taken has been positive and collaborative, and that's the way I want to continue to work with this. So I also appreciate the mayor just inviting me to present to you, and we will, as we move forward, just continue to try and maintain open lines of communication, honesty, and transparency. So for where we are today, it's 237. This is the day, as of April, the end of the day, April 30th. 237 confirmed cases in Marin. We've had 13 deaths. We've tested 3,600 people. We have 178 of our residents who are ill have recovered, including myself. 43 cumulative hospitalizations. Currently, and this is the first time this has happened, maybe since the beginning of the epidemic for us, there are no people in Marin County who are currently hospitalized with COVID-19. State of California, we have about 49,000, almost 50,000 cases total, with over 2,000 deaths, just over 2,000 deaths. We're now starting to track our incidents in Marin for some of the high-risk settings, especially for our skilled nursing facilities and residential care facilities separately, so that we can really track that particular vulnerability. And those numbers for yesterday are, we had 30 patients total in those settings. Those are the residents in those facilities, and then 25 staff in those facilities were COVID patients who are positive. We have currently five different environments like that, again, skilled nursing facilities as well as residential care facilities that have some form of activity. So that's the update in terms of the numbers. I think, as I go through those and I see that 0 in terms of, hospitalizations, that's excellent news. But it's also, I think, an important reality for us to think about, because it correlates to the overall success we've had. We have certainly flattened the curve, and I want to start with just, the gratitude that I feel, from public health perspective, and I think the acknowledgement that we should all feel that we've been coming together and adhering to the shelter-in-place order. A lot of the changes and sacrifices all of us have made really were responsible for the success we've had. You have saved lives in the work you've done every day by by not coming together, and really by sheltering at home. The flip side of that is that we have been so successful that one concern I have is that there may be a sort of a false reassurance. You know, when I see that zero in the hospital, it doesn't mean the mission is accomplished. We remain vulnerable. About 97% estimates, at least, of our population are still susceptible from an immunologic standpoint. Obviously, we're trying to be guided by the science here. And the fact is that this is a novel virus, never been, didn't exist, 6 months ago. So all of us remain susceptible to this. And when we did the shelter in place and we really locked down transmission, we were able to successfully reduce what had been a period of exponential growth in cases. And we were seeing more and more cases every day. Hospitals in the South Bay were being overwhelmed. And we were able to get in front of that with the shelter in place. But we still remain vulnerable. In fact, we're in many ways just as vulnerable as we were because the virus is part of the environment and we have so many of us as susceptible. So for some, it may seem like overkill to continue with the shelter in place, but it is because, again, we are at risk for a second surge. And so we'll be taking this process slowly and carefully as we move forward. Yesterday, we announced that we will be extending the shelter-in-place order starting on May 4th. The order that we put in place in mid-March expired on May 3rd. And it was an opportunity for us in the 6 Bay Area counties that authored that first in the nation shelter-in-place order that really was demonstrated to have saved lives in our community and regionally. We've gathered together to issue the second version of that order and have come again with a unified approach across the region. That order contains some relaxation. So the month of May is going to be characterized by some new relaxations in the order. Limitations that had been previously in place are now lifted, as well as, importantly, an interval of preparation, a real preparation for us to be able to move forward and reopen more safely. So some of the things that have changed in the order include construction. So as long as there are adherence to the standards and there's an addendum in the order for what safe construction represents in terms of being able to socially distance and other practices on the sites, we're able to actually move forward with construction. We're able to move forward with other lower risk activities, outdoor activities. One of the organizers around the way we're approaching this for this version of the order and any subsequent version is thinking things and not in terms of whether they're essential versus non-essential. That was the language we used in the first version of the order. Essential being things you really need to live. You need food, you need access to healthcare, you need access to the pharmacy. Now we're taking a step back and we're saying, well, we know that we need to rebuild our economy, and we're going to be doing that based on bringing things online sequentially based on the risk for transmission within that certain sector or activity. So again, not essential versus non-essential, but lower risk versus higher risk. And some of those lower risk activities include things that can be done outdoors, right? It makes sense because we are able to socially distance, we're outdoors, we're not packed together in tight spaces. And so construction fits into that. We also, so landscaping, gardening, businesses that normally conduct their business outdoor, if more than half of the business was conducted outdoor prior to the shelter in place, those are businesses that can come back online. Not outdoor restaurants and bars, but other businesses that are outdoor businesses can come back online. Certain forms of recreation. We know that, a lot of us have developed cabin fever. I know that in my own house with our 3 kids, and things like golf and tennis and other non-contact sports. We're not having large numbers of people coming together, but sports that can be engaged in safely with social distancing can resume, and you can expect to find parks opening for those sorts of activities. The clubhouse won't be open, right? We're still not allowing gatherings of people, but if within your own bubble, you can engage in these activities. And I use that term bubble as to signify the sort of the household group. So this is another concept that I think we're all going to need to become more familiar with, which is these groupings where I think of it as a bubble of where we've already decided that we can be together without social distancing. So in your home, you're not expected to socially distance from one another. but that bubble can't interact with another bubble without social distancing. And so another bubble that we're allowing is groups of children. So groups of up to 12 children can gather together in a stable cohort. So that same group of 12 kids can move together in childcare and other settings. If it's the same adults and the same 12 children, they can actually move together. And as we go into summer, that's going to be the way we're thinking about how we can organize ourselves so that children aren't at home all day, especially as we remobilize the workforce. We recognize we need opportunities for people to have their children educated and get the recreation they need and the socializing they need with other kids in safe ways. And that's the way we're organizing that, is stable groups of 12. So that's a different form of bubble, because we know that it's not possible to really socially distance, a group of 12 6-year-olds together. It's just not going to happen. Those are some of the key changes in the shelter in place. They reflect our intent to take a thoughtful process to this, recognizing that the shelter in place can't extend forever with the limitations we've had to endure for the past 6 weeks plus, but also wanting to make sure that certain things are in place before we move too quickly. And I'm just going to review those, if that's all right, Mayor, just to kind of go through what we see as the criteria for making sure that we have these things in place before we really do a larger reopening. So the first is, and it's sort of obvious, and we have dashboards and metrics to measure all these things to see if we're accomplishing them. The first is that we don't want to see surges in hospitalizations. If we're seeing active surges in cases and hospitalizations, we're going to have to step back and not move forward as quickly. The second is we need to have adequate testing capacity. We estimated in Marin County really to move forward safely so that we're able to identify cases as soon as possible if they occur. We need at least the ability to perform 500 tests per day countywide. And we're at about 1/4 of that right now. And new opportunities are coming online every day. And that's basically been limited by federal and state supplies of testing. We haven't had simply some of the basic necessities, and it's been obviously part of our national experience of the COVID-19 epidemic has been scarcity of whether it's PPE or testing supplies, and those things are getting relieved slowly, and we are optimizing every possible resource to bring it to you in our community as soon as those things become available. The third criteria is that we need to be able to perform contact tracing. So this is the public health workforce is being expanded so that when we do have the testing and we are able to diagnose someone, there's someone who can actually reach out immediately within 24 hours to identify that person, make sure that they're safely isolated from those around them, including if that means actually having to pull them out of a household, if they're living in a household with many others and it's impossible for them to isolate. We have units where we actually can move them into 4 walls and a door and a bathroom for them, whether it's in a motel or a hotel or relationships with schools, with dormitories. There are options across the county to actually get people out of settings where they would otherwise be exposing others. So safely, contact tracing and isolation and quarantine is the capacity to do that is another prerequisite. And our goal there is that we identify within 24 hours, have everyone who's been diagnosed safely isolated and that their contacts are quarantined. And then if those contacts become symptomatic, we test them. The fourth is that our medical facilities need to be able to handle surge. So you spoke with Pat Kendall about this, working with our hospitals to make sure that we can we can scale up our capacity if we're seeing surges in cases. And we've been ready. Because the modeling, even before we put the shelter in place in order, the modeling had shown we were going to see surges in cases. Your work prevented that from happening. And so the hospitals have been ready and they continue to be ready, and they're refining their processes, but we've met that criteria. The next is that we have a timely and accurate monitoring system. So I mentioned, obviously we need a dashboard in place, a data collection, analysis, and monitoring system so that I as health officer can actually make sure that we're meeting all those other criteria before we move safely forward. And then finally, I think the last is an obvious one, and it relates to all of us in the community, which is that we all have to be able to actually practice those safe practices that we've been talking about. We have to remember to cover our faces. We have to socially distance when we're out in public. Our businesses have to have the capacity to actually perform within their specific setting what safe operations looks like in the era of COVID-19 for a bookstore, for a hairdresser, for car showroom. Every business needs to be able to alter its practice in the era of COVID-19 to make sure that it can be done safely. And we're establishing a task force at the county to accomplish that, called Marin Recovers. And I'll just finish by outlining a little bit about that process. It's the Marin Recovers Industry Advisors Workgroup being convened under the Board of Supervisors. It will comprise of industry leaders from 8 different sectors, including restaurants, retail, construction, parks, summer camps and youth activity, transportation, hotels, motels, and hospitality, personal services, small businesses, the arts sector, real estate, and faith-based organizations. Those are the groups, and each of those has an industry leader and a group of 5 to 8 individuals who serve as advisors, and they are tasked with actually developing recommendations for safety standards for those settings that would be brought to the Board of Supervisors and to me as a health officer to refine them. And so that we, at the end of the day, we actually know that we have protocols and processes in place that will allow us to be more sure that we can move forward safely. And that will be the mechanism. Once we know we've met all those other criteria in terms of being able to safely move forward, we're not seeing surges in cases, we can test people, et cetera. And we're sure that those businesses can move forward safely. That will be the way in which we move to reopen our economy and allow us some of the the pleasure of just being together in ways that we've been missing for the last 2 months.
Well,
any questions?
You've covered an awful lot, and the clarity is much appreciated by our community and certainly me, and so I'm grateful for that. There are a few things that I particularly liked about your comments. First, I think you're taking a very practical approach. I like that. It seemed to be balanced, weighing the heavy concerns of safety versus the economy. That's somewhat diametrically opposed, but you've balanced that, I think, and you're conscious of that. And I think approaching it in certainly a logical and appreciated way. 500 tests a day, we hear about, particularly from New York, how needed the tests are, and we know we've only had about 3,000 thus far, and it seems like a population of 260,000, let's call it. That's not very significant at this point in terms of drawing conclusions, so I'm glad that that's increasing to 500 a day. That's significant.
Mayor, can I just say one thing about that?
Sure,
San Rafael, yeah, we're getting a new testing site Monday.
Right.
So today's Friday. So starting on Monday, there'll be a testing site established in the canal.
Right.
On East Francisco, and it's going to be able to do 130 tests a day, and that's just an example of one of the many operations that's coming online over the next few weeks to reach that goal of at least 500 a day.
Right. Well, I think that's commendable. I know many are interested in having a test. I was, quite frankly, and I'm in queue, but not there yet. So I think increasing that capacity is a really good step you've taken. You've outlined some criteria for the plan for opening, a series of steps to get to the end point. So I think that's quite good. I was struck by your comments with regard to the hospitals and their preparation. I understand that you've increased the capacity, perhaps by 250. I may or may not be right about that, but capacity. I think that's great to be prepared for. Let's hope not, but if there is an eventual need, but you're prepared for that, and I congratulate you for doing so. Your focus on kids in particular is important, I think, to many of us, how we're going to transition to childcare. So thank you for considering that as well. And then on a personal note, golf and tennis. That's going to be good news for a lot in our community. So thanks for including that in your group. So unless you have follow-up comment, I'll just thank you so much for joining us today. You did an excellent job, greatly appreciate it. And I would suggest we as a community are most grateful for the service you're providing. Smart guy, knowledgeable guy, right place with, So thank you for being part of that instrumental team and making the decisions you have to. I know they're unique. Probably haven't exercised them in the past, but it'll be good for the community to have you in the place of making decisions that are important to all of us. So I can't thank you enough, Matt, for joining us today. So thank you.
Thank you. All right.